Hi, my name is Lori Gordon, and today I will be performing my um, full head-to-toe assessment for advanced health assessment. This is my patient, Ms. Smith, and prior to entering the room, we took her height, weight, vital signs, and she did a near vision screening with the Snellen chart. She also emptied her bladder and put on a gown. And as she was walking into the room, I did a general inspection for her gait, which was normal and steady, her hygiene, which is good, her affect, which was normal, and she's dressed appropriately for the weather. So we will go ahead and start the assessment. We'll do an inspection first of her face and head, and the skull. It appears to be normocephalic, and the shape and symmetry and size are all normal. The skin has no abnormal lesions or nevi or rashes, and that is all. That all looks good. So to begin, we'll go ahead and I'll go ahead and palpitate the scalp, which is pink and movable and with no masses or lesions. And the eyes are symmetrical, the nose is midline, and the ears are symmetrical. As I look at her face, there are no, bone abnormalities or deformities that I can tell just from looking. And so, to begin, I'm going to palpitate the sinuses. I'll first do her maxillary, and then her frontal. And then I'll go ahead and palpitate for tenderness. Do you feel any tenderness?
No.
Okay, good. We'll test the TMJ joints. I'm going to put my fingers right here and have you open and close. Good. I don't feel any popping or crepitus, which means that the jaw is working good. Now I'm going to test the motor, the nerves in the facial region. So I'm going to have you do a couple different things. I'll have you bite down, and I'm going to have you wrinkle your forehead and close your eyes, and let's see, stick out your tongue and puff your cheeks, and I think that's all of them. Now I will I'll move to your eyes. So I'm going to have you go ahead and close your eyes for me. Good. Open them. So let's go back. I forgot to do one of the tests on your, we're going to do the light sensation. So whenever I get this cotton ball and I touch it, you say now, okay?
No.
Okay. So that was the facial light sensation, and we're going to move on to the eyes. So again, I'm going to have you go ahead and close your eyes, and your eyelids look healthy. Your eyelashes look thick and full, and the eyelids cover your eyeball, the globe of the eye completely, and the eyelashes curve up away from the globe of the eye. And so then I'm going to do I'm going to test your pupils for light sensation. So I'll just have you just look forward. This one. Good. This one. Good. They are even and normal, even, round. They're responsive to light, even, and normal, round and reactive. So they're round, reactive, and respond normally to light. Now we will do the cover-uncover test for your eyes. And I'm testing for strabismus, which is the lateral movement of the eye. So I will put this over your eye, and then as I move it away, I'm looking for lateral movement of the eye, and I don't see that, which is good. At the same So now we will do the, I'm going to look at my finger and just have your eyes follow my finger, okay? Good. Okay. Now we will move on to your ears. So, your ears are, the auricle is patent, and I don't see any lesions, rashes, or any skin abnormalities on the ears. We will go ahead and do I'm going to do the whisper test, and then I'll do the Renee test, or some people call it Rhyme. I'm not sure which one it is. So we'll do those tests, and then I'm going to look in your ear with an otoscope, okay?
Okay.
So first we will start with the whisper test. Okay, so I'm going to have you put your finger over
Pizza.
Okay, and switch.
Blueberry.
Yes. Okay. And so then this is for the Renee test, and I'm going to tap it on my knee and then put it on your mastoid bone, and then I'll bring it to this side of your ear, and you tell me when each noise stops. Okay.
Okay.
So the air conduction should be longer than the bone conduction.
Okay.
So normally that's how it is.
Okay. Okay.
Okay. Oops.
Okay.
Okay. Let's redo that one because I messed it up.
Okay.
And I forgot to say when we were doing the scalp that the hair is evenly thick, healthy, and distributed evenly. Okay, so we did the ears. Now I'm going to look in the ears with an otoscope, and I'm checking the tympanic membrane. The tympanic membrane is pearly gray. There's a good cone of light, and I don't see any inflammation. And the tympanic membrane is pearly gray. There's a good cone of light, and there's no inflammation. So we did the eyes and the ears, which are both also symmetrical. I'm going to actually look at the conjunctiva, which is pink, and the sclera is white. I'm not lacrimal apparatus, which is normal in size. Okay, so your nose is midline, and there's no abrasions or swelling or abnormal skin issues on it. There's no nasal flaring, and there's no respiratory distress noted through your nose, like no narrowing of the nares whenever you take respirations or anything like that. I'm going to have you cover one of your nostrils and sniff. Good, and the other, which shows me that your nostrils are patent. And now I'm going to do an internal examination of the nose. Okay, so the nasal mucosa is pink, and it is pink and moist, and the turbinates are intact and not swollen. There's no nasal drainage. The septum is midline, and I think that's all for the nose. Now we will move to the mouth. So I'll have you. So when I look at the mouth, I see that your lips are symmetrical. They're pink in color and moist, and no sores or cracks on your lips. So now I will ask you to open your mouth. And the buccal mucosa is pink, and the teeth are all intact. They are white in color, and there's 23 teeth, I believe, and they are normal in size and shape. I'm going to have you open your mouth again. While I look at the uvula is midline and there's no lesions, and the soft palate is pink and muscular looking, and the hard palate is bony and whitish, and the tonsils are a +1, and the pillars are the anterior and posterior pillars are there and visible, and as you say the uvula rises symmetrically. So that's all normal. Stick out your tongue. And the tongue is midline without tremors. And there are, the top is kind of rough looking and pink, and the bottom was vascular and red. And I'm going to check the floor wall of your mouth. So I'm going to put some gloves on. And so I'll have you stick out your tongue. There's no indentations or lumps. So I think that completes the oral cavity for us, okay? Let me just look one more time to make sure. Okay, good. Okay, now we will move on to the neck. So the neck is, okay, the neck is symmetrical and smooth. Can you swallow that for me? Good. There is no visual sign of the thyroid. So I'm going to check the trachea. And the trachea is midline and it's not deviated. And I'm going to go behind you and have you swallow. Good. And I'm going to lay you back and check for jugular distension. Okay. Okay, can you put your head to the side? Okay, there is no jugular distension. Look up. Now let's check the other side. Okay, so we now, I'm going to feel for the carotid. to listen. I'm gonna have you hold your breath. Okay, breathe. Now hold your breath again. Good, breathe. So no bruise noted. Next, I will palpate the lymph nodes, okay? So we have the pre-auricle, post-auricle, occipital, tonsillar, submandibular, submental. Then we have the supraclavicular and the superficial clavicle and the postclavicular. And then deep. Okay. So we will move on to the, I'll have you sit up and we'll move to the back, okay?
Okay.
So,
You want these sideways or?
yeah, that's perfect. Actually, this way is perfect.
Okay, I'm sorry.
No, you're fine. Okay, so now what we will do is we are looking at, actually I'm going to come around front, and before we do that, let's do the upper. Let's go ahead and do your arms, okay? So your shoulders and the arms and the hands, they are non-edematous and they are normal in color. There's no skin abnormalities, no lesions, rashes, or anything like that. And I'm looking at the nails and the fingers to see there's a brisk capillary refill, and the nails are non-clubbing. And I'm going to feel for the radial pulses. Good. And the brachial. Good. Okay, so now we'll do the back. And so the back, what I'm looking for with the back is I'm assessing for inspecting the thoracic configuration and that your respirations are even and unlabored. And so I'm going to go ahead and check for that there looks like there's symmetry, and I'm going to check for expansion. So I'm going to have you take a deep breath slowly and exhale. Okay, again. Good. So I'm watching my thumbs, and they rise symmetrically, so that tells me that there is symmetry. And now I'm going to palpate the back and check for fremitus. So I'm gonna say, have you say 99. You repeat the phrase 99.
99.
Again.
99. 99. 99. 99.
Good. The vibrations were even on both sides. And now I'm going to check the costovertebral angle. So I'm going to palpate across. And percuss. Is there any tenderness?
No.
Any tenderness?
No.
Okay, so no kidney tenderness noted. Now we will percuss the back, and I want to hear a resonance. Okay, that's what we're listening for. Okay, now I'm going to have you raise up your arms, and maybe let's do turn sideways so I guess the camera can see. Thank you.
Up here.
Yeah, okay. Good. Now I will also take the back, okay? Listen to your back. Press. Deep breath. Good. And then listen. Lateral. Breath. And again. It's hard. Good. Okay. Now what we're going to do is we're going to check the diaphragmatic excursion, which is kind of interesting little test. So what I will do is I'm going to have you take a deep breath, and I'm going to start at the clavicular line, and I'm going to have you take, when you take a deep breath, I want you to hold it, okay?
Okay. Tell me.
Okay, now. Okay, so we're feeling for like a change in the tone, and you exhale now. Okay, and then I'm going to do the other side too. Okay, deep breath and hold it. Okay, now I will have you exhale completely, and as you exhale, I want you to hold it, okay? Okay, so go ahead and do that.
Wait.
Okay, so when you exhale, let's see, so wait. Yeah. So after you exhale,
Just like don't breathe in again.
yes,
Okay.
exactly.
Okay.
Okay, so exhale, just yeah. So like go like okay, so okay, now I'm doing. Again. Now we're gonna measure. Perfect. It should be 3 to 6 centimeters, and yours is about 3, which I would expect because you're a smaller person. Okay, so I think that is these off, all the back stuff. So I'm going to have you turn, and I will go ahead and do the anterior. So I'm inspecting that the chest, the skin is normal in appearance, no lesions, no masses, no masses, anything like that. And your respirations are even and unlabored. You're in no apparent respiratory distress. And I'm going to first palpate for the fremitus, and so I'll have you say 99, and I'll just go in the shape. Okay. Start here.
99, 99, 99, 99, 99.
Good. The vibrations are normal and even. And now we will palpate, okay? Okay, good. And just the sides. Okay. So we want to hear that that hollow-like sound. So now I'm going to go ahead and listen to your breath sounds from the front, and then I'll listen to your heart, okay? sorry, first I need to make sure there's no thrills or heavings as I do the paracordium. Okay, so in the left apical. Okay, there are no thrills or heavings or pulsations. So now we'll do the or the atrium. Herbs. Tricuspid. And then the mitral. So, I will now ask you to, we will move on to the abdomen. And as I'm doing this, I'm thinking of things that I did not do. And before I forget to do them, I wanted to do the gag reflex because I forgot to test it. Is that okay with you?
Mm-hmm.
Okay.
Oh.
Okay, sorry. Thank you. I'm just thinking of things in my head that I didn't do and I didn't want to forget. Okay?
It's okay.
Okay, so we'll go ahead and do the abdomen and then we just have the legs after that. So to begin, what I'll want to do is inspect the abdomen for, any for contour, shape, movement, which there can always be because the bowels are always active, moving most of the time. And so as I'm inspecting, I'm going to inspect first, and then I will listen. Starting in the, listen to the lower right. Good, bowel sounds are present. Great. All the bowel sounds are present. Now I will listen to the arteries. So I'm going to listen to the aortic. Right renal, left renal, left iliac, right iliac, right femoral, and left. There are no breweries. Okay, now we will do light palpation and then deep palpation. We'll also palpate for the liver and the spleen. Okay, so as I'm palpating lightly, I'm making sure there's no tenderness or no visible pain and no masses, and there are none. And so now I will do, I will percuss the liver, and then we'll percuss the spleen, and then I'll do the deep palpation. Okay. So let's see. Okay. So insert your belly button. dullness. You want to make sure that you're percussing between the rib so you can get a feel for whether or not there's an organ. Good. 6 centimeters. Now I will start at about I'll have you, you mind to roll towards me? And I'm just gonna percuss the spleen. So at about the 10th intercostal for dullness. Good. Okay. Now I will deep palpitate, okay? Any tenderness? Okay. No tenderness. No mass is felt. Now we will go ahead and sit you up. And we will do the, I'm going to go ahead and do the legs and the feet. And they are non-edematous, warm to touch, symmetrical, the muscle tone seems good. Can you lift up your knees? Good. Your abdominal muscles are intact. Now I'm going to check the no sores, no rashes. I'm going to check the, okay, is that okay? I will do your pulses, the medial pulse, and the tibial. And then the popliteal. Did I do your radial pulse? I think I did.
Thank you.
Okay. Great. And now I'm going to do your reflexes. So I'm going to have you sit at the perfect. Here, you put your shoes back on. Okay. Okay. So we will do. Actually, we'll just start here.
Okay.
So the radial. We felt a jerk on that one, so that's good. Feeling for the jerk, that one's present. Okay.
That feels so weird.
And then the Achilles.
Okay.
So go ahead and relax your.
Okay.
Okay. Good. So now we will have one last thing. I'm going to have you go ahead and stand up and bend over. Great. So your head is supported, which tells me that your spine is strong and can support your head. The C spine is, it is, let's see, okay. So the C spine is concave and it holds the head and neck and supports that. And the thoracic spine is convex. The L spine is concave. Go ahead and stand up. And it's straight in midline. And this concludes our assessment. Thank you so much.